Diabetes is very common today, and millions of people take medicines every single day. Two of the most prescribed ones are Metformin and Glimepiride. But here is the problem. Many people think these medicines are the same. They are not. They may look similar on paper. They both lower blood sugar. But inside the body, they work in very different ways. In this video, I will explain the 7 big differences between Metformin and Glimepiride. By the end, you will clearly understand how each one works and why it matters. Metformin is usually the first medicine doctors prescribe for type 2 diabetes. It helps the body use insulin better and reduces extra sugar production in the liver. That is why it is often used early in diabetes. Glimepiride works differently. It tells the pancreas to release more insulin into the blood. Doctors usually prescribe it when blood sugar is not well controlled with lifestyle changes or other medicines. So yes, both medicines lower blood sugar. But they do it in completely different ways. Difference number 1, how they work in the body. This is the most important difference, and most people never understand it. Metformin does not force your body to do anything unnatural. Instead, it helps your body use insulin better. In type 2 diabetes, insulin is already present, but the body ignores it. Metformin fixes this communication problem. It tells the cells, listen to insulin again. At the same time, it reduces extra sugar made by the liver, especially at night. Glimepiride works in a very different and more aggressive way. It directly pushes the pancreas to release more insulin, whether the body needs it or not. Think of it like pressing the accelerator harder instead of fixing the engine. At first, blood sugar comes down fast, but the pancreas has to work overtime. So here is the shocking truth. Metformin works with your body. Glimepiride pushes your body. One improves how insulin is used. The other increases how much insulin is released. Same goal. Very different paths. Difference number 2, risk of low blood sugar, hypoglycemia. Low blood sugar is not just uncomfortable. It can be dangerous. And this is where these two medicines are very different. Metformin rarely causes low blood sugar on its own. Why? Because it does not increase insulin release. It only improves insulin efficiency. So blood sugar comes down slowly and safely. This makes Metformin a calmer and more predictable medicine for many people. Glimepiride is a different story. Because it forces the pancreas to release insulin, blood sugar can drop too much. This can happen suddenly. People may feel shaky, dizzy, sweaty, confused, or extremely weak. Some wake up at night with a racing heart and fear. Here is the shocking part. Many people think these symptoms are anxiety or weakness, but it is actually low blood sugar. If not recognized, it can lead to falls, accidents, or even loss of consciousness. That is why doctors are careful with Glimepiride. It works well, but it demands attention. Metformin is safer in this area. Glimepiride needs respect. Difference number 3, effect on body weight. Weight matters a lot in diabetes. Even small weight gain can worsen sugar control. This is where patients notice a big difference. Metformin is usually weight neutral. Some people even lose a little weight. Why? Because it does not increase appetite. It improves how sugar is used instead of stored as fat. Many patients feel lighter and more in control over time. Glimepiride often tells a different story. It can increase appetite. More insulin in the body means more sugar pushed into cells. And extra sugar often becomes fat. Slowly, weight goes up. Not overnight, but month by month. Here is the surprising part. Some people think they are failing. They eat less, but still gain weight. They blame themselves. But the medicine is playing a role. So remember this. Some diabetes medicines support weight control. Some quietly work against it. Metformin usually helps. Glimepiride may challenge you. Knowing this can change how you manage your health. Difference number 4. Best use in early versus advanced diabetes. Doctors do not choose medicines randomly. There is a strategy behind it. Metformin is almost always the first choice in type 2 diabetes. Why? Because early diabetes is mainly about insulin resistance. The body still makes insulin. It just does not use it properly. Metformin directly targets this problem. Glimepiride usually comes later. It is added when blood sugar stays high despite diet, exercise, and metformin. At this stage, the pancreas may not release enough insulin. So glimepiride steps in and pushes it harder. Here is the key truth. Doctors usually start gentle, then move stronger if needed. Starting strong too early can exhaust the pancreas faster. That is why metformin comes first for most people. Glimepiride is not bad. It is just not the first move. Timing matters. In diabetes, when you use a medicine is just as important as what you use. Difference number 5. Impact on insulin resistance. Insulin resistance is the real enemy in type 2 diabetes. It is the root problem. Metformin directly attacks insulin resistance. It makes muscle and liver cells more sensitive to insulin. This means the same insulin now works better. Less sugar stays in the blood. Over time, this can slow disease progression. Glimepiride does not fix insulin resistance. It works around it. It adds more insulin to overcome the resistance. This helps short term, but the resistance remains. Here is the shocking comparison. One medicine repairs the lock. The other keeps using a bigger key. Both can lower sugar, but only one improves the underlying problem. That is why metformin is often called a foundation drug. Glimepiride is a support drug. Managing symptoms is helpful, but fixing the cause is powerful. And in diabetes, this difference can shape the future of your health. Difference number 6. Common side effects. Every medicine has side effects. The key is understanding them, not fearing them. Metformin commonly affects the stomach. People may feel nausea, bloating, loose stools, or diarrhea. This usually happens at the start. For most people, it improves with time or dose adjustment. Taking it with food helps a lot. Glimepiride side effects are different. The biggest concern is low blood sugar. Weight gain is another common issue. Some people feel tired or weak if sugar drops too low. Here is the important message. These side effects are not punishments. They are signals. Signals that the dose, timing, or medicine may need adjustment. No panic is needed, just awareness. When patients understand their medicine, they feel more confident. And confidence improves control. Difference number 7. Long-term safety and benefits. Diabetes is not a short journey. It is lifelong. So long-term safety matters deeply. Metformin has been studied for decades. It has shown benefits beyond sugar control. It may reduce heart risk and improve metabolic health. That is why it remains a favorite worldwide. Glimepiride is effective but needs monitoring. Over time, pushing the pancreas continuously may reduce its strength. That does not mean it is dangerous. It means it must be used wisely. The shocking truth is this. A medicine can work well today but cause problems tomorrow if misused. Long-term planning is key in diabetes. Doctors weigh benefits and risks carefully. Patients should understand this balance. Because diabetes is not about quick wins. It is about lasting control. So which medicine is better? The honest answer may surprise you. There is no single best medicine for everyone. Age matters. Blood sugar levels matter. Lifestyle matters. Other health problems matter. For many people, metformin is enough. For others, glimepiride is necessary. Sometimes both are used together. The worst mistake is self-decision. Medicines are tools. Doctors know how and when to use them. The best medicine is the one chosen correctly for the right person at the right time.